let's go ahead and get started. So today's video is extremely important and also extremely high yield. Today we're going to be talking about chronic inflammation. So by the end of this video, you will completely understand the basic principles of chronic inflammation, causes of chronic inflammation, T lymphocytes, CD4 positive helper T cell activation, CD8 positive cytotoxic T cell activation, clinical relevance and examples. And additionally, we're going to throw in some USMLE practice questions to solidify your knowledge for the long term. Be sure to check out thehealingpowerofnature.com and also our Patreon for the best resources on the market. So to start, let's talk a little bit about chronic inflammation. So chronic inflammation is a prolonged inflammatory response. It usually lasts weeks to months to years, but can also last for an entire lifetime. It occurs when acute inflammation fails to resolve an insult. It is characterized by mononuclear cell infiltrates like lymphocytes, macrophages, and plasma cells, and also tissue destruction and repair happening simultaneously. It's important to remember that tissue destruction and repair happen simultaneously. So some distinguishing features from acute inflammation: it's delayed onset, but more specific. It's the adaptive immune response. It's mediated by lymphocytes, T cells and B cells, but also plasma cells. Remember that plasma cells are antibody-producing B cells. Macrophages also play a central role in orchestrating the immune response. Tissue destruction and fibrosis, healing via connective tissue replacement, are common outcomes. So some common causes of chronic inflammation, a great mnemonic that I like to use is PIVAF or PIST-AF. PIV-AF because you're going to be PIV'd AF if you have chronic inflammation. So what does this mnemonic stand for? So the causes of chronic inflammation: P for persistent infection. This is the most common cause. For an example, tuberculosis or leprosy are common examples. Mycobacterium tuberculosis forms granulomas to contain the infection. An example would be a patient with a chronic cough, weight loss, and night sweats. Think of TB whenever you see these. I for infection with mycobacterium, parasites, and fungi. These organisms evade acute immune responses. A great example is histoplasmosis or fungal infection. This is notorious for chronic inflammation and granuloma formation. Then we have V for infection. This requires T cell mediated immunity like hepatitis B and HIV. Remember, chronic infection leads to cirrhosis due to ongoing inflammation. Then you have A for autoimmune disease. This is where the body attacks its own tissue due to failure for self-tolerance, like in rheumatoid arthritis. Remember, in rheumatoid arthritis, chronic synovitis leads to joint destruction. And then we have F for foreign material and also some cancers. Examples would be silica exposure, asbestos, or cancer. So remember PIV-AF when you want to think about what causes chronic inflammation. P for persistent infection, I for infections with mycobacterium, parasites, and fungi, V for viral infections, A for autoimmune diseases, and F for foreign material and some cancers. So what are the key histologic features of chronic inflammation? You'll see infiltrates of mononuclear cells, lymphocytes, macrophages, and plasma cells. You'll also have tissue destruction, which is mediated by macrophages and T cells, fibrosis and angiogenesis. Granulation tissue forms to heal the damaged area. And also, in some cases, you'll have granulomas. This is where aggregates of activated macrophages, epithelial cells, surround lymphocytes. So the clinical relevance and examples: so granulomatous inflammation, a subset of chronic inflammation. An example of this would be TB. They create caseating granulomas, which is a central necrosis surrounded by epithelioid macrophages, giant cells, and lymphocytes. Also in autoimmune diseases like rheumatoid arthritis, chronic synovitis leads to joint disruption. Systemic lupus erythematosus or SLE is where immune complex deposition leading to chronic inflammation in multiple organs. Also, chronic viral infections like hepatitis B and C. Chronic liver inflammation leads to fibrosis and then cirrhosis. Also, foreign body reactions. So, for example, asbestos exposure leads to chronic inflammation of the pleura, then mesothelioma. Some memory aids and high-yield test points. Remember, macrophages are the key regulators of chronic inflammation. Chronic inflammation can lead to cancer. For example, hepatitis B and C, leading to hepatocellular carcinoma. Also, granulomas, where persistent antigen stimulation leads to caseating, think TB. If non-caseating, think sarcoidosis. Autoimmune diseases involve self-reactive T cells and antibodies, leading to chronic tissue damage. So next, we're going to talk about T lymphocytes. The origin of T lymphocytes are produced in the bone marrow. However, their maturation, immature T cells migrate to the thymus for differentiation and selection. So TCR, or T cell receptors, rearrangement occurs in the thymus. Differentiation into CD4 plus helper T cells, MHC class II, or CD8 positive cytotoxic T cells, MHC class II. The maturation happens in the thymus, but they are produced in the bone marrow. So remember, when it comes to T cell selection in the thymus, remember it goes positive, then negative. What do I mean by this? Well, positive selection happens in the cortex. This is where T cells can recognize self-MHC. So if it's weak binding, there's apoptosis. Then there's negative selection, which happens in the medulla. This eliminates T cells that bind too strongly for self-antigens. This prevents autoimmunity. If there's failure in negative selection, autoimmune diseases will arise. For example, if there's an AIRE, an AIR gene mutation, autoimmune polyendocrine syndrome 1 or APS1 can occur. So T cell receptor activation and function, remember that T cell receptor complexes and antigen recognition. T cell complexes require T cell receptors plus CD3. CD3 helps transmit signals. TCRs only recognize antigen when presented on MHC molecules. So remember, TCRs only see antigen on MHC. CD4 plus T cells recognize MHC class II found on antigen-presenting cells like macrophages, dendritic cells, and B cells. CD8 positive T cells recognize MHC class I, which are found on all nucleated cells and platelets. Remember that viruses downregulate MHC class I to escape CD8 positive T cells. So T cell activation requires two signals. T cells need a date to activate. So the primary signal that happens, the first signal is TCR, toll cell receptors, binds antigen MHC complex on antigen presenting cells. The secondary signal that happens is a co-stimulatory signal. So B7 on APCs binds with C28 on T cells. T cell activation. One way you can think about this is 28 divided by 7 is an even number. So basically, in order for T cells to become activated in the chronic immune response, they need two signals. The first come from MHC. The second are additional molecules. One is found on B7, which is antigen-presenting cells, which binds to CD28 on T cells. So functions of T cells. First, CD4 helper T cells, or MHC class II. This coordinates immune response by releasing cytokines. They differentiate into Th1, Th2, Th17, and Treg cells. So to help you out, I generated this image right here. Let's go through this quickly. So the first subtype, Th1, it activates macrophages and CD8 cytotoxic T cells. They produce cytokines, interferon gamma and interleukin 2, and the key mechanisms is in TB granulomas or Crohn's disease. Then we have Th2 or T helper cell 2, which activates B cells like IgE and IgA. They produce cytokines like IL-4, IL-5, IL-13. It's involved in asthma and allergies. We also have other T helper cells, Th17, which recruits neutrophils and secretes IL-17. You'll see this in autoimmune disorders like rheumatoid arthritis, cirrhosis, etc. Then we have Treg cells. These are your immune system regulators. They suppress the immune response and release IL-10, TGF-beta, and a deficiency is often seen in autoimmunity. CD8 positive cytotoxic T cells, or MHC class I, kill virus-infected tumor or damaged cells. They use perforin and granzymes to induce apoptosis, or also the fast ligand fast interactions, which also activates capsases to then in turn activate apoptosis. CD4 positive T cell subtypes. So the two major ones we're going to talk about are Th1 versus Th2. So activation of CD4 positive T cells. Remember, it's a step-by-step process. So first what happens is an extracellular antigen like a bacterial protein, fungi, parasites are phagocytosed by antigen-presenting cells such as macrophages, dendritic cells, and B cells. Then antigen processing happens where the pathogen is broken down into peptides and loaded onto MHC class II molecules. They then take those molecules and take it to antigen presentation. Basically, they put those molecules on their receptors, which are known as MHC class II in this instance, and present them to CD4 positive helper T cells. there also needs to be a co-stimulation, a secondary activation signal. This happens with B7 on antigen-presenting cell binds to CD28 on CD4 positive T cells. This is an activation boost. Then what happens are cytokines are secreted, which activated CD4 positive T cells release cytokines to shape the immune response. This allows for differentiation in Th1 or Th2 cells, depending on the cytokines in the environment. Without the second signal, B7 to CD28 interactions, T cell will enter anergy or unresponsiveness. Remember, Th1 is intracellular killers, Th2 are antibody helpers. So let's talk a little bit more about Th1 versus Th2. So Th1 are the intracellular killers and Th2 are the antibody helpers. The Th1 subset are pro-inflammatory cell-mediated immunity. They release cytokines. What cytokines do they release? They release interferon gamma, which activates macrophages, supercharged killing ability, especially towards pathogens. They also secrete IL-2, which stimulates CD8 positive cytotoxic T cells, which then go and kill viruses or cellular infected cells. Also TNF alpha, which increases inflammation, vascular leak, and fever. Remember, its functions are to kill intracellular pathogens like viruses, Macrobacterium, fungi, or protozoa. It reinforces the Th1 dominance. Interferon gamma inhibits Th2 differentiation. Now, when it comes to the Th2 subset, when it comes to Th2 cells, they are humoral or antibody-mediated immunity. They also release cytokines. The cytokines they release are IL-4, which promotes IgE class switching for allergies and parasite defense, IL-5, which stimulates eosinophil recruitment and IgA production for mucosal immunity, and IL-13, which enhances IL-4's effect, IgE production. The functions are to fight extracellular parasites like helminths, protozoa, or allergens, promotes antibody-mediated immunity like B-cell activation, and inhibits Th1 differentiation. IL-4 suppresses interferon gamma production. Next, CD8 cytotoxic T cell activation, or MHC class 1. The activation of CD8 positive T cells is a step-by-step process. First, what happens is an intracellular pathogen like viruses, intracellular bacteria, tumor agents, etc. infect the host cell. Infected cells then process and present the antigen on MHC class 1 molecules, or all nucleated cells and platelets have this receptor. Then what happens is CD8 positive T cells recognize the antigen on MHC class 1 via the TCR. However, they also need a co-stimulation, a second activation signal. IL-2 from CD4 Th1 cells enhances CD8 positive activation and proliferation. If absent, like in HIV or AIDS, CD8 positive cells fail to mount an effective response. Activated CD8 positive T cells differentiate into cytotoxic T lymphocytes, or CTLs, which kill infected cells. Remember, CD8 positive T cells are crucial for viral infections and tumor immunity. The mechanisms of CD8 positive T cell cytotoxicity is perforin and granzyme pathway, where perforins form pores in the target cell membrane, granzymes that enter through the perforin pores and activate capsases. Capsases then induce apoptosis or programmed cell death. There's also the Fas ligand or CD95 pathway. Basically, CD8 positive T cells express Fas ligand. Fas ligand binds the Fas receptor on the target cell. Capsases are activated and apoptosis occurs. The key takeaways for CD4 positive and CD8 positive T cells. Remember, CD4 positive T cells activate via MHC class 2 and also through B7, CD28 interaction. CD4 positive Th1 cells then secrete interferon gamma, which activates macrophages, and Th2 cells release interleukin 4 and interleukin 5, which secretes IgE and eosinophil recruitment. CD8 positive T cells activate via MHC class 1 plus IL-2 from Th1 cells. CD8 T cells kill via perforin or granzymes and Fas ligand apoptosis. So I know this was a lot of information. Let's bring it all together. So remember, chronic inflammation is a long-term immune response driven by lymphocytes, T and B cells, macrophages, and plasma cells, leading to tissue damage and repair occurring simultaneously. There are different cells that are involved within chronic inflammation. The key cells that we talked about today, CD4 positive T helper cells, play a central role in directing the immune response. Th1 cells activate macrophages and CD8 positive T cells to fight intracellular pathogens. Th2 cells stimulate B cells, IgE, and eosinophils to combat allergens and parasites. Th17 cells recruit neutrophils for autoimmune defense, and Treg cells suppress immune response, preventing autoimmunity, whereas CD8 positive cytotoxic T cells directly kill virus-infected and tumor cells using perforin enzymes and the fast ligand apoptosis. So how does this all fit together? When the body fails to clear an infection, deal with persistent foreign material, or misidentifies self-antigens like an autoimmune disease, this leads to continuous immune activation, tissue damage, and fibrosis, contributing to diseases like TB, Crohn's disease, asthma, and autoimmune disorders. Remember, chronic inflammation is an ongoing battle between immune activation and regulation. Understanding how T cells orchestrate this response is key to diagnosing and managing inflammatory disease. So here is a quick breakdown on some of the T helper cells we talked about today. So remember, the different type of T helper cells are a type of CD4 positive T cell. Basically, what happens is when there's a problem in the body, like a parasite or a bacteria, the cells, your antigen-presenting cells like your macrophages, your dendritic cells, or your B cells, will take those antigens to these cells. Once they are there, these helper cells will tell the immune system what to do. So for T helper 1 cells, their function is to activate macrophages and also CD8 positive T cells. CD8 positive T cells are important because they kill intracellular pathogens or also cancer. They also produce signals like interferon gamma, which also goes to promote macrophages, and interleukin 2. The key pathologies you'll see is TB granulomas and Crohn's disease, whereas with Th2 cells, remember this activates B cells for class switching between IgE and IgA. This is specifically important for mucosal immunity and also for allergies. Cytokines that are produced are IL-4, IL-5, and IL-13. IL-4 helps with IgE class switching, IL-5 helps with eosinophil recruitment, and IL-13 helps more IgE class switching. It's common in asthma and allergies. Th17 we didn't talk too much about today, but Th17 recruits neutrophils. IL-17, which it produces, neutrophil recruitment, and IL-22 also is involved in mucosal defense. You'll see this as well with autoimmune diseases. Whereas with Treg cells, think of them as your regulators, they suppress your immune system. So once an infection is cleared or inflammation is no longer needed, Treg cells come into the process, suppress immune response, and release cytokines that also promote suppression of the immune response. For example, IL-10 inhibits Th1, TGF-beta suppresses the immune response. A deficiency, well, if you can't turn off your immune system, there's going to be autoimmunity. The body will start to attack itself. Let's go ahead and jump into a couple of practice questions. Like I will always tell you, start with the last sentence, read all of your choices, then read the entire answer. I'll go ahead and give you a few minutes and then we'll come back together and review this question together. So if you chose C, interferon gamma, that is correct. That's because granuloma formation in TB is driven by Th1 mediated immunity, specifically the release of interferon gamma. Interferon gamma activates macrophages, enhancing their ability to kill mycobacterium. Remember, IL-4 promotes Th2 differentiation and IgE production. IL-5 is involved in eosinophil recruitment. IL-10 is anti-inflammatory, and TGF-beta also suppresses the immune response. Let's go ahead and jump into another question. I'll go ahead and give you a few minutes, then we'll come back and review the question together. So if you chose C, that is correct. Remember that IL-12 is essential for Th1 differentiation. This leads to interferon gamma production, and a deficiency in IL-12 receptor results in an inability to properly activate Th1 responses, making the patient highly susceptible to mycobacterium infections. Remember, IL-2 promotes T cell proliferation, but is not key in cytokine impairment. IL-4 drives Th2 responses and is unrelated to mycobacterial immunity. IL-5 promotes eosinophil function in allergies and parasitic infections. IL-17 is produced by Th17 cells and recruits neutrophils. Let's go ahead and jump into one more question, and then we'll come back and review the question together. So if you chose A, that is correct. Remember, T cell activation requires two signals. First, on the MHC interaction, then additionally through the co-stimulation of B7 binding to CD28 on the T cell. B7 is on the antigen-presenting cell, CD28 is on the T cell. 28 divided by 7 is 4. That's how you can remember this. CD4-MHC2B and CD8-MHC1C interactions are necessary for antigen recognition but do not provide the second activation signal. IL-2 receptor activation promotes T cell proliferation but does downstream of activation. Fast ligand mediates apoptosis, not T cell activation. So that concludes our video for today. If you found this video helpful, please like and subscribe. Also be sure to check out the healingpowerofnature.com for some of the best resources available on the market. I know this was a very heavy, in-depth lecture, but be sure to stick around and watch the video multiple times. A lot of these concepts take time to recognize, and also our Pathology 101 book will help you out immensely throughout this process. But here is an in-depth overview of the cells that are involved in chronic inflammation, as well as some of the mediators that are also involved. Thank you very much, and we'll see you next time.